name's Dana. I'm your nurse today. Can you verify your name and date of birth for me? Good. So today we'll be using a cleansing enema. The doctors ordered a retention enema and a return flow. It's going to start with inserting a tube in your rectum. I'm going to instill fluid. I'm going to have you hold on to that fluid, and then you'll expel that in a bedpan, okay? All right, let me don PPE. I'll put my gown on and gloves. All right, so I'm gonna place your bedpan here so that it's easily accessible when you need it. I have lubricant, I have my tubing, and for the cleansing enema, we're going to use a bag that will hang about 12 centimeters above your rectum. All right. I'm gonna lube one end of the tubing about 3 to 4 inches along the tubing. And then before we do any insertion, let me actually assist you into the Sims position. So I want you to turn on your left side. Your right arm is going to be right along your head. Your left arm is going to be along your side. And then I want you to raise your right knee. Okay. All right, so that just gives me a little bit easier access to your rectum, okay? And then I have this pad here that will place down so that your linens aren't soiled. All right. Now we've lubed our tubing about 3 to 4 inches along the shaft. And let me actually spread the buttocks and I'll assess the area for any lesions, skin breakdown. Everything checks out fine. All right. And I'm going to actually prepare my enema bag. We're going to hang this. I'm going to use my cleansing solution. Typically it's a Castile, pure Castile soap. I'm going to pour that in here. It's about 750 to 1,000 milliliters of solution. All right, and then let's see. Okay, I'm going to connect one end of my tubing to the bag, and then that's going to hang there. Again, about 12 to 15 centimeters or inches above your rectum. And then the tubing is already well lubricated. I'm going to insert here about 3 to 4 inches. This is an adult. All right. Okay, it's important first to prime the tubing. So I'm going to release the clamp. I'm going to prime some of the tubing into the bedpan. I'll prime some of the solution into the bedpan. All right, then I'm going to close my tubing. It's well primed. I'm going to open my clamp and then we'll insert here. Okay, the solution is expelling. And if you feel any abdominal cramping, any discomfort, I'll dislodge a little bit. And if it's too unbearable, then we'll have to stop the infusion. Okay. All right, so that is done. You'll most likely feel a bit bloated. I want you to hold on to that solution for as long as you can. Typically with the cleansing, we'll hold for about 10 to 15 minutes. So I'm going to help, actually let me remove my gloves. Hand hygiene. Okay, let's assist you back into your original position. All right, and then again, you'll hold on to that solution until you have to go, as long as tolerated, and there's your bedpan. Do you have any questions? Okay. All right, so now if I were giving a small volume enema, I would auscultate the patient's abdomen for any unusual bowel sounds, or just the presence or absence of bowel sounds. That's indicative of peristalsis. Okay, that I would have my patient again organize themselves in the same Sims position. I would be fully gloved and gowned. The small volume enema is only about 100 mLs. It comes in a tube here, and I would insert that in the rectum. Again, the patient would hold for as long as tolerated and expel that as needed. For the large volume, the return flow enema, now that one works a little different. So the tubing would go into the patient's rectum. The other side would be attached to a bucket of sorts. And as I insert, the liquid from the bucket would then flow into the patient's rectum by gravity. And because it's return flow, I would then lower the bucket. The contents within the rectum would flow into the bucket, and then I would raise it, and the content would flow back into the rectum, and then again I would lower it. We would do that for about 4 times, and that is the return flow enema. And if the solution became too infested or contaminated, I guess, with feces or was thick, I would then replace that fluid and continue that process, like I said, for about 3 to 4 times. The patient would be returned to their original position, hand hygiene. I would then don gloves and remove all of my items to dispose of them. You can stop it.